To the latest of State Senator Bill Dodd's virtual town halls. Tonight's event is presented in partnership with KSVY 91.3 FM in Sonoma and Sonoma TV, and features Senator Dodd and his distinguished panelists talking about the major public health threat posed by the availability and proliferation of opioids and the deadly drug fentanyl, and what we can do to address that. I'm Rick Wynn, one of the volunteer hosts on KSVY. This evening's town hall is being presented on multiple video platforms, including Senator Dodd's Facebook page, sdo3.senate.gov.ca, Sonoma TV, Comcast Channel 27 in the Sonoma Valley, sonomatv.org, and the Sonoma TV channel on YouTube. For audio only, you can listen on KSVY 91.3 FM in Sonoma, Napa, and Petaluma, or you can stream us on ksvy.org or your smart home device. Again, tonight's subject is the major health threat posed by the availability and proliferation of opioids and the deadly drug fentanyl, and what we can do to address that. Senator Dodd and the panelists will take your questions beginning around 6:30. The studio call-in number is 707-933-9133. That's 707-933-9133. We also have questions previously submitted by email. I'll make every attempt to get those not addressed by the panelists in their opening remarks and subsequent discussion. Senator Dodd represents all or part of 6 North Bay counties, including Napa, Sonoma, Solano, Contra Costa, Sacramento, and Yolo counties. And now I turn it over to Senator Dodd, who will make his opening remarks and introduce this evening's panel. Good evening, Senator.
Good evening, Rick, and thank you to KS and KSVY for convening this with me, our latest in a series of town halls. It's our 20th monthly virtual town hall since the pandemic started. I also want to take this opportunity to thank all our panelists who are giving their time here tonight to put out some really important information. And that's one of the things that, that we do is we take phone calls from constituents about ideas on what we need for our town hall. And this was one that was brought to my attention about 2 months ago. And, we'll be talking about the major public health threat posed by the availability and proliferation of opioids and the deadly drug fentanyl, and what we can do to address that. And I'm very, very glad to be joined by this distinguished group. And thanks to the hundreds of people tuning in tonight, the fact you are here shows your concern. We will take your email questions and open the phone lines for your calls at 6:30. The call-in number is 707-933-9133. The coronavirus pandemic has rightfully dominated public discussion for the past 2 years, as the lives of more than 6 million people worldwide have been tragically cut short. California has suffered nearly 90,000 lives lost due to the pandemic, but we focused efforts on beating the virus with vaccines and other measures, and other deadly public health threat has been quietly taking its toll. Illicit drugs are killing people in record numbers. Preliminary data from the U.S. Center for Disease Control and Prevention suggests the nation is on track to see at least 105,000 drug overdose deaths in 2021, up from 93,000 the year before. In California, overdoses claim more than 10,000 lives during this period. And in many cases, I want to make it clear, we talk about overdoses because that's the metric. But, in many cases, these are, drugs that people are taking that, perhaps are not thinking they're overdosing in any way, shape, or form. But when this drug is laced with fentanyl, the result is more than likely death. This is an alarming trend. New research showed a particularly large jump in overdose deaths among 14 to 18-year-olds. Adolescents' deaths were fairly constant for the most of the last decade, about 500 a year, according to a paper published by the Journal of American Medical Association. But they almost doubled in 2020 to 954, and the researchers estimate that the total hit nearly 1,150 deaths last year. Experts attribute the spike to fentanyl, a highly lethal drug that is more than 50 times stronger than heroin. More recently, it's also been pressed into counterfeit pills resembling prescription drugs that teens sometimes use. Teenagers, like older drug users, don't need to become addicted to opioids to suffer an overdose. Many kids trying to get their hands on prescription opioids, such as oxycodone, end up taking fake pills laced with fentanyl instead. And sadly, some people are killed the very first time they take the drug. It's a huge problem. In California, confronting it is a top priority. Disrupting the supply chain is one approach. Primarily, fentanyl is being smuggled into the country by cartels in Mexico. We must go after these distributors, and we are. But we also must educate parents and teenagers about the dangers of drug use. We must educate them on how to respond to overdoses, including the use of Narcan, the overdose reversal drug. And of course, we must increase addiction treatment. We must change laws to make it easier for doctors to dispense life-saving medicine. In the legislature, we're working on it, but simply put, not getting enough done yet. This year, we're voting on a number of bills imposing stronger penalties for distributing the synthetic opioid and easing access to safer consumption and treatment. One proposal would allow for prosecutors to pursue a sentence of 20 years to life for those who distributed fentanyl that resulted in a deadly overdose. It would make it a felony to possess 2 or more grams of the opioid. Another would crack down on social media as a marketplace for opioids. Still another idea would create safe injection sites. But as I said before, there's still more work to be done. Here tonight are 4 people to talk about the current drug crisis. Attorney General Rob Bonta has been California's top law enforcement officer since April of last year. Following a stint as San Francisco City Attorney and Alameda City Councilman, he was elected to the Assembly in 2012. He was the first Filipino-American to serve in the legislature. He established himself as a champion of, now as Attorney General, he's continuing that track record while vigorously protecting the public. He's particularly been aggressive in confronting the opioid scourge. Also here tonight is a parent, co-founder of the Napa-based fentanyl awareness nonprofit named for her 20-year-old son, Michael Leonardini, who died from fentanyl poisoning. So she has lived this. And we have Dr. Mario San Bartolome, medical director of social determinants of healthcare for innovation and board member of the California Society of Addiction Medicine. Finally, we'll hear from Dr. Tauhid Zaman, addiction psychiatrist at the San Francisco Veterans Administration Medical Center and assistant professor of psychiatry at University of California, San Francisco. I do want to let our people out there to know that I'm right now in Sacramento in the middle of 2 committee hearings, and I'll be called down to vote. I hope I can be here for all the questions, but if you don't see me for a while, I will be back. But now let's hear from our Attorney General, who is my colleague in the Assembly and obviously in the legislature for my past 8 years, a man that I respect greatly, Attorney General Rob Bonta.
Thank you, Senator Dodd, for that very kind introduction. And thank you for the series of town halls that you've been putting on. What an incredible public service you provided to your constituents and beyond. And I just want to thank you for being the incredible leader that you are, the wonderful colleague that you were when I served in the legislature, and my always friend. Really appreciate the partnership and your leadership and the opportunity to be here with you. I'm honored to join you, certainly, and also the other leaders that are here today to kick off this important town hall, to come together across disciplines to draw attention to a crisis that has taken over 1 million American lives, a crisis that demands action across California and across the nation. The opioid epidemic has torn families apart. There must be justice for what has been done. There must be accountability for those responsible, from big pharmaceutical companies on Wall Street to fentanyl dealers on Main Street. At the California Department of Justice, we have put in a considerable amount of time to not only hold the peddlers of the opioid epidemic accountable, but also to secure financial assistance for our communities that have been left devastated. As we engage in this work, we know we can't bring back loved ones or fully heal the life-altering impacts of this epidemic. But what we can do, And what is on display today is chart a path forward together, preventing future death, future addiction, and future pain. This path demands that we secure not only accountability from those who caused this crisis, but real relief for the communities working to control it. It requires substantial investments in awareness, in abatement, in addiction, and recovery efforts. That is why I'm proud that the DOJ has secured approximately $32 billion nationally in settlements to combat the opioid crisis. California alone will receive more than $2 billion from the settlements we've secured so far with Johnson & Johnson, Cardinal, McKesson, AmerisourceBergen, and others who hold responsibility for this crisis. And as Purdue and the Sacklers attempt to skirt their responsibilities in bankruptcy court, we're making sure that they're held to account as well. These settlements will fund opioid addiction treatment and provide billions of dollars in funding for education and other abatement activities in communities across the state, including, yes, in Senate District 3, Napa, Solano, Yolo, Sonoma, Contra Costa, and Sacramento counties. The funds will soon be available to local governments and organizations via grants to ensure that our communities have the funding and tools they need to invest in critical awareness, abatement, addiction, and recovery efforts. The panelists you will hear from shortly are leading some of these on-the-ground efforts day in and day out. Solving this crisis requires them, and it requires all of us working together, working collaboratively at every level to heal our communities. We all have a role, whether it is medical practitioners limiting appropriate use of prescription opioids, law enforcement reducing the flow of illicit drugs, community organizations and clinics helping people seek treatment for opioid misuse, or an everyday person recognizing the signs of an overdose and seeking help. We must all deploy best practices, implement harm reduction tools, and do our part to blunt the risks of death, addiction, and injury. This epidemic can only be solved if we continue to work together in partnership and in collaboration. And I'm hopeful that with accountability and enough resources, we can stem the tide and heal our communities. So let me end where I began with a big thank you to Senator Dodd for your leadership, your friendship, for organizing this important convening. Thank you to the leaders and advocates here today, our distinguished panelists who are making our communities healthier and safer. I'm honored to join all of you. I look forward to learning about the outcomes of this conversation and working with you and all our partners to end this crisis for good together. Thank you all for being here.
Thank you, Mr. Attorney General. Senator Dodd has been called away, so I'm going to take over the introductions here. Our next speaker is Mona Leonardi. She's a co-founder of the Napa-based Fentanyl Awareness nonprofit named for her son, Michael Leonardi, who died from fentanyl poisoning. Ms. Leonardi?
Thank you so much. Good evening. My name is Mona Leonardi, and I'm Michael's mother and co-founder of the Michael Leonardi Foundation. Thank you for attending this important town hall on the current fentanyl crisis and learning about the danger of illicit fentanyl and fake prescription pills and other street drugs. We tragically lost Michael on February 24th, 2020, from fentanyl poisoning at the age of 20 years old. Fentanyl is a synthetic opioid. It's extremely powerful. It's up to 50 times more potent than heroin and 50 to 100 times more powerful than morphine. Legally, it is a drug used to relieve severe pain in patients in a hospital setting and administered by a licensed doctor. Illegally, it is being used in street drugs by drug trafficking organizations and dealers. It's extremely dangerous and lethal when on the street, and it's highly addictive. Michael ingested what he thought was a Percocet prescription pill. What he actually got was a fake prescription pill that looked real and contained a lethal dose of fentanyl. The person that sold it to him on the social media platform Snapchat did not disclose this information and deceptively sold Michael a fake lethal pill. This person was actually a drug dealer that was easily found on Snapchat, and its profile had hundreds of likes and drug emojis. This purchase was made with a push of a button and delivered immediately. Michael grew up in Napa County and was living in San Diego at college. He was in a good place in his life, living by the beach with his housemates and his sister close by. He was a gifted guitar player, was very social, and had many friendships. Michael ingested this fake pill on a Sunday evening while watching a movie with two of his roommates, and they found him unresponsive the next morning. It was too late. Fentanyl had shut down his respiratory system and he stopped breathing. The toxicology report we received 6 weeks later showed no oxycodone from a Percocet pill in Michael's lab results, only fentanyl. He was poisoned. I believe he took this pill for relief of his anxiety and was self-medicating. This poisoning didn't just happen to Michael, it's happened to thousands of other victims as young as 12 years of age that are unaware they were given fentanyl in a fake pill, cocaine, heroin, or other street drug like meth, and this continues to happen on a daily basis. Teenagers and young adults are easily purchasing these pills through social media outlets like Snapchat or getting through friends that are buying online. And they have no idea what they are getting or the immediate danger. Drug trafficking organizations are able to purchase fentanyl precursors easily from suppliers and press into pills using a pill press. They shape, color, and stamp these pills to look like the real prescription pill, like a Percocet, Xanax, or Adderall. Fentanyl is cheap. They don't have to grow it like cocaine or heroin. Not much has to be used because it's so potent and it's easy to transport. But these drug traffickers are not trained in how to dose fentanyl, and they don't know how to mix it properly and have no quality control in the process. These results in pills that have lethal doses of fentanyl. They're making huge profits from this deception and taking the lives of our children, siblings, and loved ones and getting away with doing so. It only takes 2 milligrams of fentanyl powder to kill an average size adult. That extremely small amount fits on the tip of a pencil, and there's no way to tell the difference between a real or fake prescription pill in the illicit drug market. The Drug Enforcement Administration has tested these counterfeit pills, and 2 out of 5 are lethal doses of fentanyl, or 40%. 98% of the pills in the drug market are all fake. A fentanyl death can happen to anyone that is purchasing illicit drugs. There's no discrimination. Deaths are occurring to first-time and recreational users, that includes teenagers and young adults, along with those with substance use disorder. The number 1 cause of death for the age group 18 to 45 since 2020 is fentanyl. In a 1-year period ending September 2021, approximately 70,000 deaths occurred in the United States that were fentanyl related. In California, that estimate for the same period is 5,300 fentanyl deaths. This is a 316% increase from the annual rate in September 2019 for California. Our California drug laws need to be more forceful in going after drug dealers and their suppliers who deceive with fentanyl and are causing thousands of deaths. Current California bills like SB 1350 that was heard today by the Senate Public Safety Committee, and parents took part in voicing their support for this bill to committee members, including myself, and AB 2246 that was heard last week, are all steps in the right direction. The countries that are supplying fentanyl and drug trafficking organizations that are selling these fake pills need to be stopped. We need to have a state fentanyl awareness campaign for schools, college campuses, and every community in California. Awareness and prevention education is the fastest way right now to save lives, as fentanyl is in the illicit drug supply. Thank you.
Thank you very much. I really appreciate your testimony. Dr. Mario San Bartolome, you are up, sir. Welcome.
Thank you very much. And it's certainly a privilege to be here. I'm a homegrown from the district, so it's a pleasure to be here. You know, I know that there's also going to be another presentation here from one of my esteemed colleagues. And so, you know, maybe what I can bring to this conversation really has to do directly with the patient care that I provide. I am involved in multiple levels with health plans, with medical legal representation as expert witness, and then along with medical societies all around substance use. But most importantly, I see patients and families. And so I serve these families that suffer from substance use related issues. I saw about 20 patients just before coming on this call here, and I can tell you that about half of them are involving fentanyl. Youngest patient, 16. I saw a woman in her 3rd trimester of pregnancy as well that is currently dependent, looking for resources. Some of the discussion that's already been talked about here has been around the supply side. What do we do about stopping people from bringing in the substances? That's very much a legal type of or justice system type of approach. Though I serve, certain jails for, reentry folks that are coming out of the incarcerated environment that have substance use issues. I'm going to actually focus on the part that has to do with the demand side, which is what do we do about the education and access to care for substance use issues, including those that involve opioids and then possibly an overdose. And it's really kind of a different side of the coin. And we've actually been through this before. It's maybe difficult to put together, but this is arguably our fifth wave of opioid use in this country. When we go back to the 1800s and there were opium dens, there was legislation passed then. In fact, we created pharmacy boards because of it, because of opium and cocaine to regulate things. Our second wave came around with prescription opioids. Another wave also came around when we kind of clamped down on prescription opioids, and then people moved to heroin, and heroin became our focus just not too long ago. And then fentanyl became the focus of it. And then now we're entering this whole new one, actually, where fentanyl and stimulants are actually beginning to drive the whole curve of deaths. And that's one that we might not, discuss here too much, but it's already been mentioned that the thing that's different about fentanyl as it relates to opioid use is that these days you can die of an overdose and not even ever have been addicted to an opioid. So you could go and think that you're using something like a stimulant, or sometimes young folks will also experiment with things just to see what happens. And that could be a one and done for you. Unlike what happens with alcohol, where somebody might get intoxicated, usually does not end up in a death. But certainly with fentanyl being that, a couple of grains of sand in size could be the difference between life and death. It's something that it's certainly very important. It can also not involve any sort of an opioid at all at any point in terms of what brings somebody to the exposure. We've even had cases of folks that go to actually aid somebody that has overdosed, and by some sort of secondary exposure themselves, because of an aerosolized exposure to an opioid, they become exposed to it and then can have an overdose. Now, most overdoses are non-fatal, okay? So it is grossly underreported. So even the numbers you see there, you have to realize that people are not reporting the overdoses that happen where they don't end up going to a hospital and receiving medications or dying. These are the ones that we code for as physicians and that we try to keep data on, but there's so much more. This is the tip of the iceberg type of situation. So some of the things that I'm going to mention here really are around, number one, we definitely, from the demand side of things and the education, we definitely need to continue to address stigma. Stigma kills. That when people feel that they have a need, there's this misunderstanding of what addiction is, that it is, a moral failing or something along that line, that we need to continue to educate people. These studies that addiction is a disease of the brain. It involves the reward pathways. It involves genetics. It involves environmental issues, and it involves traumas. It can also involve somebody own self-medicating for other conditions that are co-occurring, mental health or medical. We also know that access to care is an issue. And we're in a state that carves out substance use from the managed care side for Medicaid, for example. Well, there are all sorts of issues around access to care, but really we need to continue to look for a no wrong door type of approach. Wherever you hit the system, that system needs to be able to offer you treatment. Not go to jail, but treatment. And of course, for those that are dealing, and I'm not talking about that group, I'm talking about the user of that. And they need to be able to stick and have a comprehensive approach. We need to increase the integration into what is standard medical practice. We still live in a time where substance use issues are siloed. The idea that these things belong in a rehab of some sort, that somebody needs to go to a rehab. I want you to know we have a system. If you look at the rehab system, like the idea of having a residential treatment facility, that would be like treating diabetes with amputation centers. That's end stage. We need to be doing a lot more way before. And that means that it's just as important along the continuum of care, this idea of prevention, harm reduction, right? Not this thing where we're thinking that it's a one and done, somebody goes into treatment and then they're good. Very, very important. And I'll finish with saying that we still have a fragmented type of system. So whole person approach really is it. All of overdose is but one of the things that's driving all of the morbidity that we're seeing, or the mortality in that case. So there's so much more for us to do. And so, I'll lend some of that out here for more discussion with maybe some of the questions from a physician who sees patients, most days.
Thank you, Doctor. Now we're going to move to Dr. Tauhid Zaman. Welcome, and you can begin. Thank you.
Great. Thank you, Senator Dodd and fellow panelists. I'm so grateful to be here today. I lead a medical team that actually sees people with opioid use disorder and people who've experienced overdose across our entire healthcare system. And I'm here to tell you that this is affecting every part of our healthcare system, from the outpatient clinics to the emergency rooms to the ICUs. So Dr. San Bartolome mentioned that it's important that we not silo care. As a part of that, my team really spends time educating other physicians, nurses, psychologists, social workers in the treatment of opioid use disorder. This has become as crucial as ever during the COVID-19 pandemic, and I would like to focus my remarks today on a little bit of what the epidemic has looked like and evolved into during the pandemic. Please let me know if you have any difficulty seeing my slides here. I should mention that I have no conflicts of interest related to this topic. I'm not sponsored by any pharmaceutical industries. And I wanted to start by showing you some data about overdoses by substance in San Francisco during, in some ways, the latter part of the epidemic, or the pandemic, excuse me. I'm talking about the COVID-19 pandemic. Of course, we're still in it. However, this is data from January through June of 2021, and I share it with you because it mirrors some of what's happening across California and across the nation. And you'll see that as you look at the data, and this is all data from the Office of the Medical Examiner, and the data all pertains to what drugs were present in someone's system at the time of accidental overdose, you'll see certainly that fentanyl, which is that blue line, has kind of gone up steadily over time. So certainly it's a major culprit. However, the two lines right below fentanyl, the yellow and the green, actually correspond to methamphetamine and cocaine. So increasingly, there is an overlap between the opioid use disorder and opioid overdoses and people's use of stimulants, including what's been mentioned about people accidentally overdosing, thinking that they are using another substance. And so really, we must focus on holistic treatment, as Dr. San Bartolome mentioned, including treating people's stimulant use disorders, which can also significantly reduce their risks of a fentanyl overdose. As an aside, what is fentanyl and where is it coming from? Some of this has been mentioned, but I thought it might be helpful to just have a brief review. So fentanyl acts on mu receptors. That's a pain receptor in the body, and it's present throughout our nervous system. It is 100 times more potent than morphine and 50 times more potent than heroin. Illicitly, it is available as a powder. It can be pressed into counterfeit tablets, and I cannot tell you how many patients I've had who thought they were using Xanax or Percocet or oxycodone and were shocked when their system actually turned up positive for fentanyl. It can also be easily mixed with heroin and with stimulants, including methamphetamine and cocaine, as I mentioned. It can be used in a variety of different ways. Injected, used intranasally, smoked orally, and patches can actually be cut up and used transmucosally, often through the cheeks. It goes by several common names. These are ones that I've come across: Apache, China Girl, China White, Dance Fever, Jackpot, Murder 8, etc., though many of my patients will just call it fentanyl. I have been asking my patients and many colleagues who work in the field why people are using and overdosing at higher rates than ever before during the COVID-19 pandemic. And that's because this is really the perfect storm. And many of my patients describe this. They describe having reduced treatment access during the pandemic, not just to SUD, which is substance use disorder treatment, but for their non-substance use disorder mental health treatments, their anxiety disorder, their depression, their psychosis, their PTSD. Reduced access to treatment for all of those conditions increases the risk that someone will use a substance and potentially overdose, including with fentanyl. We've already talked about the increased accessibility and potency of these drugs. There's also delayed treatment of co-occurring conditions. We spent a while telling people to stay away from medical facilities and avoid risk of COVID exposure. So folks haven't been getting adequate treatment of their chronic pain issues or their mental health issues, and that can increase the risk. Many of my patients describe the toxic mix of COVID, politics, and climate change anxiety, which particularly for those of us in the North Bay who've lived through wildfires, I think we can all kind of attest to the stress that that poses for all of us. And some people may turn to substance use as a way of coping. Isolation, being unhoused and using alone are huge risk factors for overdose. When someone is using alone, they're much less likely to be rescued with Narcan if they're using with someone else. And so that has been a huge risk and has been a driver of overdose deaths as well. And finally, crises like the COVID-19 pandemic really magnify existing inequities in our healthcare system. So people who were vulnerable before are still vulnerable, and even more so now. That includes adolescents, that includes the homeless, that includes veterans, among a number of vulnerable populations, and we must pay attention to and address those inequities. So with that, I want to transition briefly into what we can do about it, and I hope we'll talk about each of these four things. So when I teach about this to colleagues and to patients, this is what I think about. I think that we need to consider preventing use, actually preventing someone from starting the use of opioids, and that has to do with access. If someone starts and is not able to stop immediately, I think we have to take a harm reduction approach that can include supporting them in using less over time, having access to Narcan, et cetera. If they have an opioid use disorder or an addiction to an opioid, which not everyone does, we can help support them in getting group and individual therapy or one of the evidence-based treatments, medication treatments for opioid use disorder, which include buprenorphine, methadone, naltrexone, or naloxone, or Narcan for rescues. And finally, we can treat coexisting conditions that might be someone's stimulant use disorder, that might be their anxiety, their depression. We really have to treat the entire person to treat this epidemic. With that, I'd like to thank you all for listening and turn it back over to Senator Dodd. Thank you.
You're on mute.
Yeah, after 20 of these, you'd think I'd have it down by now. So I'm so sorry. Just wanted to thank all our speakers this evening. And Rick, now let's get into some questions, please.
Okay, we have the phone lines are open at 707-933-9133. And you may call in now. We do have a caller, Loretta from Napa. She's on line one. She's a treatment provider. Loretta?
Yes, hi, my name is Loretta Littman, and I'm a program director at a local nonprofit, Aldea, and that's in Napa County. And I just want to say we do have services available to those who are listening. We serve youth in Napa County, and we're soon to be opening up a SUD, or substance use program, in Solano County as well. And what we do is we provide treatment for youth ages 12 to 21, and we also provide prevention services by educating youth in the schools. So our hope is to kind of get that awareness, that education out there, and prevent as well. We've also recently partnered with the Michael Leonardi Foundation to help spread awareness, and we do that by the use of harm reduction approach. We've been handing out stash bags to youth, which helps them know to test their drugs before use. So that was one approach we took, and hopefully also a deterrent to using. But yeah, we have a lot of different strategies. And like I said, we're also launching a Solano County program as well. So there are services available to those in the community. And I just want to thank everyone on this call for your support on this critical topic, because it is very much needed in the community. Thank you.
Rick, before you go to the next question, I'd like to recognize Aldea. They're celebrating their 50th anniversary this Saturday night for 50 years, doing great work throughout the area. Thank you.
We have an emailed question from, or a kind of a statement and a question from Raina Peterson, who's a caregiver with the California Don't Punish Pain rally. While we must take serious measures to prevent more deaths from opioid overdoses, please discuss steps and proposals for simultaneously protecting the lives of pain patients who rely on opioid medication, take their meds legally, and are medically monitored on a monthly basis. Government overreach has been a problem for us since 2016. Which one of the doctors would like to take that? Dr. Mario?
I'm happy to take that, sure. So, that's a very wonderful comment. So 2016, what happened? The CDC guidelines came out. The CDC guidelines on the treatment of chronic pain with opioids. And so one of the things that came from that, or these set of guidelines that created these, numbers that were like ceilings and floors and all these other kind of recommendations that, though well-intended, the intention was to decrease the burden of opioids out in the world and to have some sort of a control for how they were being prescribed in particular. So these are prescribed opioids, not the kind that we're talking about that are illicit, right? And certainly there was a problem for that. In many ways, some believe that and there's good evidence for that. It's possible that we might have overdone it. And that, in fact, right now, as we speak, they're rewriting that. They're redoing those 2016 guidelines, and it's based off of feedback, like the caller or the woman that provided the email here, is that folks with chronic pain that are doing what they're supposed to do and trying to get on in life and survive something that might be quite tragic and not something that a procedure can't take care of, that they should not be stigmatized. And then that providers, that physicians that learn about opioids need to know that withholding or abruptly stopping or putting somebody in withdrawal or taking the attitude of like a punishment type of thing, that is inappropriate. That we have to treat people with pain that have pain, chronic pain, with dignity, and that we need to also use some common sense. A chemical, does not have a personality. So the idea that something's good and bad, that's not appropriate for the discussion around opioids. Opioids can be a fantastic thing if you broke your arm and you have your bone sticking out of your arm and they need to reset it. If they offer you that, I'd say take it. However, chronic pain, it's been a bit more controversial and it hasn't been such a great tool to use for the chronic pain patient, but there are times when they can be appropriate. So I think that maybe speaks to that, and that's being changed right now at the federal level.
If I may add on to that, about 90-something% of my patients have serious chronic pain issues. So I agree with those comments. I'll also mention that all of my patients who are prescribed opioids, sometimes at very high doses, many of them have not been offered any alternatives. Many of them were put on opioids a long time ago and were told that is the standard of care and you can be on this for as long as you need to be and it's perfectly safe. That was actually not accurate. That was actually misinformation. So what's most important to me is that my pain patients have access to all of the options, including, if it means for a certain number of them, safe ongoing prescribing of opioids with appropriate monitoring. That's fine with me as long as they're functioning and they're safe. However, I really want people to have the option to have access to physical therapy, acupuncture, any number of other medications that are also very effective for chronic pain conditions and well studied. I want people to have access to all of those options. And given that access, many people do come off of their chronic opioids and still continue to function quite well.
We have Roxanne from Roseville. I'm not sure what her question is, but she's on line 3. Roxanne? Hello, Roxanne. Well, I guess we don't have Roxanne. Fentanyl is obviously a main concern, especially given that what Ms. Leonardi mentioned about her son, and my sincere condolences. And how it gets here is many of the questions, if not most of the questions we got from email addressed closing the borders. Our unprotected southern border has led to a catastrophic increase in fentanyl coming into this country. And of course, the Mexican cartels are the #1 provider. China was #1 until about 2019 of fentanyl. What action is being taken? We've got the illegal aliens, terrorists, the whole litany. And there were 5 people who sent in that question, which I just summarized basically. So Senator Dodd, the borders are really a federal issue, but there is some concern about California not supporting closing the borders, and can we speak a little bit about what role the borders have in and what can be done about stopping the flow of fentanyl from Mexico?
Look, at ICE, I don't want to make excuses either. This is a federal issue there. You made that clear, but I think regardless of being a federal issue or not, it is an important issue for the state of California because our kids are, dying at a rate that's just absolutely outrageous. I do believe that while people will say that the borders are open, the reality is drugs have made their way in from Mexico when we've had strong borders, when we weren't letting anybody in and do anything. So we've just got to have a stronger presence, at the border in terms of our search and seizure. I don't know. I'm not an expert in this. I don't know how it gets into the country. Mona, maybe you have a better idea on that and maybe can comment on that.
Yeah, I can comment on that. So they are, drugs are coming in through the border. I think that there's a lot of focus on that, but I think what people aren't talking about is where these drug cartels are getting their supply. They're getting their supply from labs in China. China is the biggest pharmaceutical producer. So China is sending drug cartels fentanyl precursors. These drug cartels get it, they put it all together, they have no quality control, they just stick it in with a bunch of white powder, stir it up, and they start pressing fake pills. There's other countries involved as well, but China is the biggest, their labs are the biggest supplier of Mexico. So why is nothing happening there? Why are there no sanctions? We have sanctions with Russia, with what's going on with Ukraine. So why can't we sanction, China and the other countries making, that have drug traffickers? So that's a huge part, going to the root of it. And then, there's also social media. It's like once these drug dealers get these pills, they go to social media. It's right in plain sight. You don't have to meet them in an alley. You go to, these kids have iPhones, they have Snapchat, they have Instagram, and it's so easy. And what's scary about that is the algorithms. So these drug dealers on Snapchat, they look out for these kids doing searches. I actually get drug dealers contacting me, I think because the foundation has the word fentanyl in it. And I get drug dealers contacting me. So I have to, turn them in. I work with a DE agent still in San Diego. I send them their information, but they're out preying on our kids. So I know I got a little off the question, but yeah, so I think our government has to do something. They have to go to China and say, knock it off. They have to go to the drug cartels. So I hope that answered your question.
Rick, you're on mute.
Sorry, I was muted. Our drug lines are bursting. 707-933-9133. We have Jilly of Windsor on line 1. Jilly. Drug lines are bursting. 707-933-9133. Jilly, turn down your radio.
Yeah, hi.
Turn off your radio.
Okay. My son overdosed in 2020 down in the Tenderloin. Had started young in high school and was getting it from doctors. Why aren't the doctors being held? I mean, the amount of opioids they're still prescribing is outrageous. So why aren't they being held responsible?
Dr. Mario, would you like to take
Sure. Doctors are being held responsible. Actually, there's a lot of scrutiny right now. In fact, it's led to some doctors not prescribing opioids even when they should be. And the rate of prescriptions that are measured, because all controlled substances are logged in, in a system that was trackable for each state. It's been going down for over a decade. It's been going down a lot. And so if you know, I guess the main reason that I bring that up is because our overdoses have been going up. So prescriptions have been going down and deaths have been going up. So although I think that in the, I mentioned the various waves of the opioid epidemic, and one of them was the prescription opioid epidemic, in which time it was the most out of control. It was the time where there's a lot of misinformation. Dr. Saman had mentioned already about the misinformation from the standpoint of marketing. This is what we're seeing with the prosecution of a lot of the pharmaceutical companies that were detailing doctors and giving them bad information. I'll also say, because I have quite a bit of my time is spent as an expert witness on the medical legal side, and a lot of times it is actually to prosecute, as an expert against these, these so-called pill mills that still exist in some places. It's a lot less than before. DEAs are there's systems now where we can track them, and people, they're being figured out if they do prescribe irresponsibly. In addition to that, the medical board, even if they don't put you in jail, the medical board can actually take away your license because of unprofessional conduct, which means somebody could not have even been hurt. But the way you're doing the prescribing is just irresponsible outside of the standard of care. And you can get in trouble for that too. So and I think nobody, including physicians that are doing the right thing, would ever want to protect any sort of a provider that's doing anything in the wrong way that hurts people. But it is happening, but you have to look at this distinction between the deaths and the prescriptions. The fentanyl is the key to that. And that's because it's illicit. The fentanyl, let me be very clear. The fentanyl that people are dying from does not come from the pen or the electronic click of any doctor, PA, NP, any prescriber that's licensed to prescribe. Those are illicit. They're coming from other places. Even though that medication does exist in the form of a patch and possibly used for surgery, that's not what's being smuggled out and being used and sold and people die. You're on mute again, Rick.
Line 3, we have Diane of Forestville with a question. Diane?
Yes, I would like to suggest that because so much of this drug is being ordered by people online, children online, and being delivered via the postal service, unbeknownst to what's in these parcels, that could we employ drug sniffing dogs to identify things? Back when anthrax was a problem, I was a carrier then, and we had a special place to put our suspicious parcels that we brought in from the route, and they were then tested. But anyway, that's a kind of a practical way to deal with it on site, perhaps, and that's what I have to suggest.
And that does make sense if, but that of course is a federal issue with the post office. I don't know that. Can dogs find fentanyl? Do we know? That's not for us.
Yeah, there was something recent a few months ago where I think it was like Central Valley. Someone was stopped and there was a dog, Benny, that found a lot of fentanyl pills. I don't know if because I know fentanyl, you can't, to humans, you can't smell it or taste it. A dog might be able to. So I don't know the exact answer. I just know that case, they did find it with Benny, the dog.
If it could be done, it sounds like it makes sense. We have the Dr. Fenton of Napa on line 2 who wants to ask about a bill in the legislature to test for fentanyl. Dr. Fenton?
Yeah, thank you. My name is Andrew Fenton. I'm an emergency physician at Queen of the Valley Hospital in Napa. And I don't think that most people are aware that current drug screening tests that we use in the emergency department in the hospital, they don't include fentanyl. So we can't pick up this synthetic fentanyl. I've personally treated many fentanyl overdoses, and I'm frustrated that when I send a test out, I can't identify the drug. So there's a bill out there, it's in the Senate, SB 864 Melendez, that would require hospitals to test or to include in their urine drug screening test fentanyl. So I'm hoping that the doctors on the call would support that bill 864, and I'm hoping, Senator Dodd, that you'd also support that. I think it'll help practitioners diagnose and treat this what is becoming an increasing epidemic.
I would absolutely support that bill, and I want to say we've had some success around this recently. So fentanyl test strips are actually relatively affordable. So we've done a couple of things in our healthcare system. So we've made fentanyl test strips available to patients, actually, if they request it. We've trained patients on how to use fentanyl test strips and actually test their supply of whatever substance they may be using to make sure there isn't fentanyl present. That's actually a proven harm reduction method that is now available for free to all of our patients and their families. And I have had a number of people, even in the last year, actually discover fentanyl unbeknownst to them that they were using and get away from use as a result of that discovery. I think that's a powerful tool. We've also worked within the VA healthcare system, which is federal, to make fentanyl testing a standard part of our drug panel, at least in our VA system here in California. And that has led to an increased diagnosis of fentanyl being present in people's systems when they come to the emergency room. So we've been able to counsel them appropriately and also connect them to treatment. So I think these efforts really need to be standardized across different systems.
Mario, do you have a comment?
Yes, I'd absolutely support that. But I would extend it. There's two things, and I don't know if it passed or not. I know that it was a discussion about those fentanyl strips being considered drug paraphernalia. So it was a problem. And many states actually struggle with this now, where even though we can give that out to people that are actively using it to harm reduce, right? And they can test whatever they have and they can make the decision. Do I use it? Do I not use it? It has fentanyl in it. And I didn't intend for it to have fentanyl. So maybe that decision point. Studies have shown people make actually decent decisions around that. And a lot of people thought they wouldn't, but they do. So very useful. But I would actually also say there's another problem besides in the ER. Most care happens outside of the ER. And guess what? We don't have in the United States what's called a CLIA waived fentanyl option, unless it's for forensic purposes or research purposes, which means me at my little clinic, let's say, seeing patients that have substance use issues, cannot have a cup that has fentanyl in it and then base a clinical decision off of the result. I'm talking about everywhere else outside of the ER. So it's also a problem there, and it's really quite ridiculous that we are limited to just the forensic side of it or research. I should be able to make a clinical decision for what medication I give, what services I provide, or what safety things I do based off of the availability of a fentanyl strip outside of it. It has to do with this thing called CLIA, which is kind of this, it's what controls laboratories and what we're allowed to do. And so that's another area that I would say we need to extend it to if we really are serious about this.
Roxanne is on line one. She wants to ask about a plan for chronic pain patients. Roxanne?
Yes, hi. Thank you for having me. I wanted to ask what can be done for the chronic pain community that's been impacted by the CDC guidelines that have cut us off or tapered us back so much that we can no longer function or work or anything else due to this illegal fentanyl crisis, not, so to speak, opiate crisis that keeps being put out there.
Doctors?
Go ahead, Dr. Salman.
Well, so, I'll just, some of it's already been said, from the standpoint of it's being those guidelines are being revised, and the thoughts really are that they are going to be improving the type of guidelines that they're putting out there for doctors. The doctor also, there needs to be a lot of education that gets put out there and more research in things that provide improvement in quality of life and function that aren't opioid options. So that's a whole kind of a big area. It's a big lofty one. We're not going to solve it overnight, but certainly the education part and having those guidelines line up once again to have, for those that have chronic pain, that are being used in legitimate ways, that they're treated with all the respect that patients with any other condition would have, and not the stigma around that, or to be forced into withdrawal. Quite frankly, that forcing of people into those has also driven people to have to self-medicate in other ways, because the pain doesn't go away just because you stop providing the opioid. It begs the difference to the point here of also, is there a difference between addiction and dependence? Okay, this is one that gets confused often. And yes, most people, all people on chronic opioids are dependent. They're dependent. Any one of us, if we were exposed long enough to an opioid, would be dependent. It means that if you took away the chemical, we would experience a withdrawal, some sort of a consequence. But that's not the same as addiction, which requires kind of, in order to meet criteria, a lot of other psychosocial, other dimensions in your life to be falling apart. So it's not the same thing to be just dependent. So, I definitely hear that. And Dr. Zaman might have some other, opinions about that as well.
Dr. Zaman, if you would keep it short, we're right up against it.
Absolutely. So I'll just say I completely agree. And I think that this is also a matter of resources. A lot of healthcare systems don't actually offer access for patients to other evidence-based treatments for chronic pain beyond opioids. So sometimes patients have a choice between opioids or nothing. So I think healthcare systems really need to do a better job providing people access to behavioral and medication treatments for pain, and really have a plan for a patient in place before they get tapered. So that's something that we're very conscious of. We don't want to send people into withdrawal and have them turn to illicit substances. So that is really unacceptable.
I'd like to thank all of our panelists tonight. We're up against the hard stop for this town hall. Senator Dodd has been called into a committee. Ms. Leonardi, I'd like to have you give the last word on this as someone who has been so tragically affected by the fentanyl crisis.
Thank you. I just want to speak to the parents, grandparents, anyone that's involved with teenagers and young adults, because we focus on the 14 to 24 year age group. These kids are not dying from overdosing. When you overdose, you have to take a lot of pills. These kids are taking one pill, or even in some cases half a pill, and they're dying. And they're dying because they're being poisoned by drug dealers and drug cartels who are making a quick buck to sell our kids what they think is a prescription pill. It looks exactly like the same thing. You can go to dea.gov/one pill. The DEA has photos there. You can't tell the real from the fake. So I think it's really important to have these conversations with your kids and just say, hey, have you heard what's going on with these fake pills? Because there's a 40% chance that if they use that pill, their life is going to be gone. And our lives are devastated without Michael. So I just wanted to really get that message out there that, yes, this side of the fentanyl crisis, these teenagers and these young adults, they're familiar with prescription pills. They either get, they've gotten one before, either for surgery or something like that, or they saw their parents take one, so they feel safe. And when they see it online, they say, oh, that's that Percocet, exactly what Michael did. So I just wanted to, put that message out there to have those conversations.
Very, very important message. Thank you so much. Thank you all for being here. Senator Dodd is back in his committee thing, so I'm going to do the close. Thank you for listening. Thank you for submitting your questions. Thanks to the callers for calling in. Thanks to everybody back at the studio for putting this together, and we'll probably do it again next month or so. Anyway, good night, everybody.